In the previous video, we have seen the parotid capsule, the external features of the parotid gland. In this video, we are going to discuss the structures within the parotid gland. Which are they? From superficial to deep. The first is the seventh cranial nerve. Which is the seventh cranial nerve? It is the facial nerve. How can we remember the seventh cranial nerve as the facial nerve? Look, this is F for the facial nerve. So we can remember the facial nerve as the seventh cranial nerve, just opposite the mirror image. That is the 7. Then the second important structure, that is the retromandibular vein. Then the third one, the external carotid artery. First of all, the facial nerve and its branches. The facial nerve and its branches, it enters the parotid gland through the posteromedial surface and it divides into two trunks at the behind the neck of the mandible into two trunks. Which are the two trunks? The temporofacial trunk and the cervicofacial trunk. This temporofacial trunk, it again divides into two branches. Which are the two branches? The temporal branch of facial nerve and the zygomatic branch of facial nerve. Then the cervicofacial trunk. This trunk divides into three branches. First is the buccal branch, which again divided into upper buccal branch and the lower buccal branch. Then the marginal mandibular branch and the cervical branch. It can be kept like this. This is the temporal branch, this is the zygomatic branch, this is the buccal branch, this is the marginal mandibular branch, and this is the cervical branch. So these terminal branches, it forms a network. It calls the pes and serinus. These 5 terminal branches, it emerges out through the anterior border and the apex. So then the second structure, it is the retromandibular vein. It is formed within the parotid gland by the union of the superficial temporal vein and the maxillary vein. And at the lower end of the lower part of the gland, this retromandibular vein, it divides into, gives two divisions, anterior division and posterior division. This anterior division, along with the facial nerve, it drains into the common facial vein. And this posterior division, along with the posterior auricular vein, it drains into the external jugular vein. Then the third important structure, it is the external carotid artery. It enters the parotid gland through the posteromedial surface and it gives two terminal branches. Which are they? That is the superficial temporal artery and the maxillary artery. Then there is another branches also in the parotid gland. They are the transverse facial artery and the posterior auricular artery. So let us have a quick recap on the important structures within the parotid gland from superficial to deep. They are the facial nerve and its branches. First, it enters through the posteromedial surface of the parotid gland. It divides into two trunks, the temporofacial trunk and the cervicofacial trunk. The temporofacial trunk again divides into temporal branch and zygomatic branch. The cervicofacial trunk, it divides into buccal branch, which again dividing into upper buccal branch and lower buccal branch. Then the marginal mandibular branch and the cervical branch. These 5 terminal branches, it emerges out into through the anterior border and the apex. Then the second important structure, that is a retromandibular vein. It is formed within the gland by the union of the superficial temporal vein and the maxillary vein, and at the lower part of the gland, it gives two divisions, anterior division and the posterior division. Anterior division along with the facial vein, it drains into the common facial vein, and the posterior division along with the posterior auricular vein, it drains into the external jugular vein. Then the third important structure, the external carotid artery. It gives two important terminal branches within the parotid gland, that is the superficial temporal artery and the maxillary artery. When we discuss about the parotid gland, its secretomotor supply, otherwise called the parasympathetic nerve supply, have special importance. So here the preganglionic fibers that arises from the inferior salivatory nucleus, it passes through the glossopharyngeal nerve, which is the 9th cranial nerve. Then it passes through the tympanic branch of glossopharyngeal nerve. Then it forms a network called tympanic plexus. Then it passes through the lesser petrosal nerve. Then it relates to a important ganglion. Which is the important ganglion? It is the aortic ganglion. From this aortic ganglion, it forms the postganglionic fibers. Then it passes through the auriculotemporal nerve and supplies the parotid gland. Again repeating, the preganglionic fibers arises from inferior salivatory nucleus. It passes through the 9th cranial nerve, that is the glossopharyngeal nerve, and it passes through the tympanic branch of glossopharyngeal nerve and forms a network called the tympanic plexus, and it passes through the lesser petrosal nerve and relate to the important ganglion, the aortic ganglion. From this aortic ganglion, the postganglionic fibers are arising and it passes through the auriculotemporal nerve and it supplies the parotid gland. The important applied aspect of the parotid gland, which is related to the facial nerve, is in parotid tumors and in parotid gland surgeries. If there is any facial nerve injury occurs, it will affect which group of muscles? It will affect the muscles of facial expression. Again repeating, in parotid tumors and in parotid gland surgery, if there is any injury to the facial nerve, it will affect the muscles of facial expression. Thank you.